What we should do is allow individuals to own their own insurance and have the same tax treatment as companies get. You do that, and people like this young woman would be able to own her insurance. The rates would be substantially lower for her buying it individually than if she had to buy it individually today.
The problem with the answers from Congressman Gingrich and Governor Romney is that, well, they didn't always say what they're saying. Governor Romney was the author of Romney Care, which is a top-down, government-run healthcare system, which, read an article today, has 15 different items directly in common with Obamacare. Everything from the increase in the Medicaid program, not just the government is going to mandate you buy something as a condition of breathing, mandate that you buy an insurance policy, something that Governor Romney agreed to at the state level, something Congressman Gingrich for 20 years advocated that the federal government can force each and every person to enter into a private contract, something that everyone now, at least up on this stage, says is radically unconstitutional. Congressman Gingrich supported for 20 years.
I didn't advocate federal mandates. I talked about at a state level, finding a way which included an escape clause that people didn't have to buy it. Finding a way to try to have people have insurance, particularly for wealthy people who are simply free riding on local hospitals. But the fact is, it was a personal system dramatically different than either Romney Care or the version Rick just described.
Governor Romney.
The system that we put in place in our state was something we worked out with the labor community, the healthcare community, business, and the citizens of the nation. We came together. It was voted by a 200-person legislature. Only 2 voted no.
What Governor Romney just said is that government-run, top-down medicine is working pretty well in Massachusetts, and he supports it. Now, think about what that means going up against Barack Obama, who you're going to claim, well, top-down government-run medicine at the federal level doesn't work and we should repeal it. And he's going to say, wait a minute, Governor. You just said that top-down government-run medicine in Massachusetts works well. Folks, we can't give this issue away in this election. It is about fundamental freedom. Does everybody in Massachusetts have a requirement to buy health care?
Everyone has a requirement to either buy health care or pay the state for the cost of providing them free care. Because the idea of people getting something for free when they could afford to care for themselves is something that we decided in our state was not a good idea.
So in Massachusetts, just to understand that, in Massachusetts, everybody is mandated as a condition of breathing in Massachusetts to be able to buy health insurance. And if you don't, you have to pay a fine. What's happened in Massachusetts is people are now paying the fine, because health insurance is so expensive, and you have a pre-existing condition clause in yours, just like Barack Obama. So what's happening in Massachusetts, the people that Governor Romney has said he wanted to go after, the people that were free ridership has gone up 5-fold in Massachusetts. 5 times the rate it was before. Why? Because I'll be happy to give you the study. 5 times the rate it's gone up. Why? Because people are ready to pay a cheaper fine and then be able to sign up to insurance, which are now guaranteed under Romney Care, then pay high-cost insurance, which is what's happened as a result of Romney Care.
First of all, it's not worth getting angry about. Secondly, secondly, 98% of the people have insurance. And so the idea that more people are free riding the system is simply impossible. Half of those people got insurance on their own. Others got help in buying the insurance. Obamacare takes over health care for the American people. If I'm president of the United States, I will stop it. And in debating Barack Obama, I will be able to show that I have passion and concern for the people in this country that need health care, like this young woman who asked the question. But I will be able to point out that what he did was wrong. It was bad medicine. It's bad for the economy, and I will repeal it.
Let's move on. Let's move on.
Wolf. What Governor Romney said is just factually incorrect. Your mandate is no different than Barack Obama's mandate. It is the same mandate.
All right.
He takes over, you take over 100%, just like he takes over 100%, requires the mandate. The same fines that you put in place in Massachusetts are fines that he puts in place in the federal level.